Guys, welcome back. This is Mobeen. So we have been talking about the immunology questions, and the questions are oriented around the topics which I have already delivered. So go back to YouTube, listen to the lectures, immunology lectures which I have delivered. These questions are potential USMLE questions out of the topics I have delivered. All right, so let's see. Today is a question number 4. Today is 31 December as well. So last day of the year. I'm very excited that we are handling this question. So the question is very simple, and I hope that you already know the answer to this, but again, keep the immunology lectures in your mind. The question is this: you receive a patient. So there are multiple ways to present this question. So I'm gonna present this question in multiple ways as well for you, so you can see how this question can be posed to you. One, and number two, as a doctor, these are various scenarios which will occur for you. So first scenario: a patient comes to you, let's say 40 years of age, comes to you with difficulty in swallowing, dysphagia, and you do the physical examination. You do not see much. His mouth is clear, he looks okay, but he has difficulty in swallowing for 1 week or 2 weeks, and you send him out for biopsy, and he comes back and biopsy shows Candida albicans. So that is one way of putting the question forward, and it is possible that they don't say Candida albicans, they would give the single cellular yeast or something like that, or fungus. The other way the question can be posed to you is: here is a 70 years old patient who has been taking let's say steroids for some reason, and he comes to, after starting on steroids, he comes to you and he has complaint of difficulty in swallowing, or he has developed oral thrush or something like that. So similarly, sometimes antibiotics. Candida albicans is a commensal commensal organism of our body. That means it lives within us, almost all of us. Usually Candida would start living in a baby within the very first few days of the birth, and it is commensal, meaning we do not have any advantage of the Candida itself, but Candida has advantage by living in us. So anyways, so the other scenario is that the patient is on steroids or on antibiotics, or there is some hormonal disturbance, or there are some physical environment disturbances. All those things actually cause Candida to become flared up, if you will. So that could be the leading into the cause, and then the question could be that how will the Candida be handled, or which cells, which immune function failed to handle the Candida and this particular problem occurred. So now let's very quickly see how Candida is handled. So here is the important thing. So let me put the question one way. Patient comes to you, has difficulty in swallowing, you send him out for lab test, come back, and the lab tests come back, and the patient has Candida albicans. The question now, hear the question out very clearly. The question is, what immune function disruption or what immune cell problem will cause Candida to become systemic candidiasis? Very important. I went from mucosal candidiasis to systemic. So first thing to note is that Candida can be in system, in the body, in the blood, or it could be on the surfaces. So either one of those. So the patient is there, has Candida. What will cause the Candida to go into the blood? Or it could be the other way. The patient is coming to you and he has developed oral thrush or some other muco-cutaneous candidiasis symptoms. What cellular function or immune function disruption caused it? So let's put some cells here. So let's say first scenario, dysphagia. And the question is, what cellular failure would cause systemic, this is the key word, systemic candidiasis. The other question could be, the other way it could be put, is that a patient comes with thrush or vaginal candidiasis or cutaneous candidiasis, comes to you with thrush. What cellular function failure caused this? So it can be asked both way. So let's try to explain this question now. So I could put other things here in the choices. So I could say, well, in the cellular, what cellular function? I could say T helper. So here are the choices: T helper 1 cell suppression or failure. That could be one choice. The other choice is T helper 2 cell failure. The other choice could be neutrophil failure or neutropenia. Other reason could be defective B cells, and so on. There could be more. Right? So here are the choices to answer both of those questions. Both questions can come in many flavors. What is the actual answer to this? So let's attempt this question now. So to attempt this question, what you must know is that candidiasis can occur for mucocutaneous areas or systemic. These are two separate diseases. And normally in healthy patients, it is very rare to develop candidiasis systemic or mucocutaneous. Systemic is more dangerous. It is an urgency and needs to be taken care of very quickly if it happens. So let's say this, we understand that now we have candidiasis of, let's say, mucocutaneous areas. Let's say I'm just going to use thrush as an example, candidiasis in the mouth, or it could be in the blood vessels. Here is what you must know. So let's say this is the blood vessels. So here is something which you must know. This is what they're trying to ask when they ask you a question like this. The Candida albicans, when it is handled, when it is present in mucocutaneous areas, when it is present on the superficial surfaces, the cells which handle candidiasis are T helper cells. T helper, and which T helper? T helper 1 cell. So do not forget this. T helper 1 cells are needed to handle mucocutaneous candidiasis. So any reason which would cause T helper 1 cells to become deficient or become defective in their function, that reason would cause mucocutaneous candidiasis. For example, HIV. HIV causes the reduction of the T cells, and that would in turn cause oral thrush. It is very common in HIV patients. Then, for example, patients on the immunosuppression therapies, for example, patients with the organ transplants or patients with the grafts, normally we keep their immune system down and they can develop candidiasis. Or there could be patients who are on steroids. Steroid cause immunosuppression as well. There could be patients with on antifungal therapies, antibiotic therapies, and so on. So any reason which would affect T helper cells would cause mucocutaneous candidiasis. So when the question is asked at which cells are handling candidiasis on the surfaces of the body, the answer will be T helper 1. T helper 1. Remember this pathway that here is the antigen presenting cell. Antigen comes in, goes into the antigen presenting cell. Antigen presenting cell goes to the T. Remember, naive T cells. This is something which you must remember. Naive T cells, and then this T cell. So this is naive T cell. Either can go to T helper 2 track or can go to T helper 1 track. T helper 1 track is the cytotoxic track, and this track is what would then cause activation of the macrophages and other phagocytosing cells, and they would then go attack the particular antigen and take care of it. T helper 2 is the humoral pathway. This activates B cells, which then release antibodies. So in case of candidiasis, T helper 2 pathway does not work. That is not the pathway through which candidiasis is taken care of. This is the pathway. So which cell is important? T helper 1 cells. So we are done. If we have that question, the patient comes to you with dysphagia, you send him out for the endoscopy, comes back with the Candida albicans, which cellular function may be disrupted. So in this particular case, T helper 1 cell. So that might be disrupted for so many reasons. T helper 2, no. Neutrophil, no. Defective B cells, this pathway, no. Now let's handle the other scenario. Patient comes to you, or patient is in the hospital. Normally systemic candidiasis is a dire situation, so he may not be walking around with the candidiasis. So you find a patient who has developed systemic candidiasis. What is the cell which is responsible to take care of the candidiasis in the blood? So here is the trick. This is what they want to know. Inside the blood, in systemic candidiasis, the cell which takes care of the Candida albicans is neutrophil. They do phagocytosis and they clear the fungus. It is not T helper cells. So it can be seen in another way. For muco-cutaneous candidiasis, the response, so do not forget this, you have to write it down somewhere. The response is adaptive immune system. Adaptive immune system. That system responds to control candidiasis. But if there is systemic candidiasis, then neutrophils take care of the problem, and neutrophils are part of what? They are part of what? I have taught it before. They are part of adaptive immune response. Sorry, why did I say adaptive? They are part of innate. These are part of innate immune response. So here is a summary of this topic. Systemic candidiasis is handled via neutrophils, innate immune response. Muco-cutaneous candidiasis is handled via T helper 1 cells, not T helper 2 cells, T helper 1 cells, and that is a adaptive immune response. Okay, thank you very much. I'll see you again.